when the doctor was removing the colon cancer and sewing up the wound, some cancer cells got into the scar. And also there were 3 nodules in the left upper lung.
Which he did not treat.
None of the sites that we treated
originally
came back. All the sites we treated went away. So these are new sites, meaning the chemo didn't work, but radiosurgery worked. So in this man, it was like an experiment. The radiosurgery worked in 4 sites. The chemo didn't work.
And it even got bigger.
In other spots. No, it got new spots.
Got large.
Everything we treated stopped or went away.
And the other things, anything.
And these new spots, so it means
bigger.
that the chemo didn't work.
Yes.
So it's like a randomized experiment. Radiosurgery worked, and we're better than Ted Williams. Ted Williams batted .400, and he was the best baseball player in history, right?
Yes.
Okay, so in this man, we're batting 1,000. And so now we're going to treat those tumors in the scar and in the left upper lobe. He's having a biopsy of the scar for a different kind of cancer treatment where doctors actually grow the cancer cells in a laboratory and expose the cancer cells, his own living cancer cells, to maybe 50 different kinds of chemotherapy to try to find a custom chemo that works better for him.
And for his kind of cancer, because every cancer acts differently.
Every cancer acts differently, and if you give the same treatment to every patient, it's not going to be very likely to work.
They go in a restaurant. Not everyone wants the same food.
Not everyone wants a cheeseburger at the restaurant. That is right. So we wish this patient well, and we're going to be starting treatment for radiosurgery of his lung and that cancer in the scar. It's 5 treatments, non-invasive, and if the history is any prediction of the future, he's going to do great with us.
I look forward to hearing about him.
You're going to hear about him even when you call me from California, where you're going this week. Another patient we're treating with hyperthermia to the breast.
So hyperthermia is a kind of heat treatment?
Hyper means more than, right?
More than heat.
More than normal heat. So she's getting heat treatment to the breast. It's a woman who had metastatic breast cancer, meaning it traveled through the bloodstream, went to various sites. She's had radiation before. She had it to the other breast, which worked. The cancer's still in remission to the other breast. And she had it to painful bone metastasis. We often use radiosurgery for bone pain from cancer, and it usually 90% of the time relieves the pain and suffering and shrinks the cancer. And now we're using, her doctor wants to give her more chemo, and she wants more chemo, but she wants to do something better for that right breast.
And more targeted than just chemo.
Right, she wants to use hyperthermia. Hyperthermia heats the breast, it heats the cancer, and allows more chemotherapy to go to the breast and to go to the cancer in the breast for hopefully a better response. Heat's been used since the time of Cleopatra. So it's a long, long story. We had another woman who came this week, not today. She's 91 years old.
Lucky.
She looks like she's 61. She walks down the street. She lives in Harlem. She's the most beautiful, spry woman you've ever seen. Incredible.
Yeah?
She lives 91. When she told me she's 91, I nearly fell out of my seat, out of my throne. She goes bowling every Thursday. She said, Doc, I can't see you on Thursday. I'm going bowling. I go bowling every Thursday. Her doctors want to put her on hospice, which means
end of care.
End of life care. And she's bowling every Thursday. She says, can't go on hospice. She goes bowling every Thursday.
Well, I'd rather go bowling than hospice.
Yeah, I'd rather go bowling, too. So they're putting her on hospice. She has colon cancer. She's had some pain. They didn't even do a PET scan on her. They didn't do any tests to see where the cancer was.
What did they do?
Put her on hospice. Nothing. It's incredible.
That doesn't sound
There's
good.
a lot of strange things going out there. You know what I tell people to do?
Get a second opinion?
Yeah, they could get a good second opinion, get a fresh second opinion. This woman wants to live. She wants to go bowling every Thursday. She's spry, and I want to keep her that way.
So what did she have?
She has colon cancer. We're going to work her up. We're going to get a PET scan, see where the cancer is, and we're going to talk about all the options. She can decide what she wants. If she wants hospice, that's great. If she doesn't want
to bowl
hospice,
for the next 30 years,
she wants to keep bowling. And she's a very, very spry woman. I wish her very well. We had another woman who came in this week, 40-year-old woman from Russia, who had cervix cancer, stage 2 cervix cancer. We treated her a year and a half ago.
That's a little while.
Yeah, we treated her a year and a half ago. She had focused beam radiation and chemotherapy, and she's in complete remission.
That's great news.
It's great news. She had a large mass on her cervix. She had active cancer. She had pain. We treated her, and now she's back. We got a PET scan on her. The cancer's completely gone.
And no pain?
No pain. She's fully active. She's gaining weight. She is very happy, and the physical exam also is negative.
That's great news to hear when they can go back to their regular life.
That's why this field, radiosurgery, is such a fantastic field, because the vast majority of patients are happy. The patients are happy. The doctors are happy.
And it's very targeted therapy that tries to avoid the systemic side effects.
That is correct. We had another man. I know you get tired of talking about prostate cancer, but I like to talk about prostate cancer because for me it's very, very fascinating.
And it's very interesting.
It is interesting. So this is a man, 70-year-old black man, went to a major, huge medical center, which we all know what it is. He had a Gleason 7 cancer, PSA 6. Now, the usual treatment for an aggressive cancer is either radiation or surgery. That's what the usual is. It's not, I like one method, but let's just say in America, those are the two main options.
Two common ones.
He was given cryotherapy for his first treatment.
So that's the opposite of hyperthermia. Cryotherapy
Right.
is
freezing
you
therapy.
freeze.
Right. You turn the prostate into an ice ball. Okay, so he turned his prostate into an ice ball. A year later, it didn't work. He had another cryotherapy treatment.
Again.
Another one, a second one, so he had two. His PSA went up to 30. He had no benefit. He lost all sexual function. He's urinating every 30 minutes. He's angry as heck.
I would be too.
He and his son came down to see me. He's on Avodart with a PSA of 30. Now, you know what Avodart does?
Tell us.
Well, Avodart's used for men with prostate problems, but it artificially lowers the PSA. So here you're trying to follow a man with prostate cancer, and they're giving a medicine that interferes with the follow-up.
With the hormones, so you can't see it.
But his PSA is still 30, even though the Avodart lowers the PSA. He's urinating every 30 minutes. He's impotent. He's angry. He's got a Gleason 7 cancer, and he wants a chance to be cured.
And Gleason 7 is a pretty intermediate risk.
Gleason was a pathologist. He tried to tell us how aggressive cancers would be. So Gleason 7 is considered a higher risk cancer. Everything higher than 6 is considered higher risk. And he's got a PSA 30. So we're staging him up, making sure the cancer hasn't traveled. And then we'll talk to him about potentially curative therapy, not treatment that just, benefits someone else.
But it's always good. If he got second opinion in the beginning, it might have been better.
Okay, but it's too late for him. We're going to try to help him. Hopefully his cancer is localized and we can give him a chance for cure.
That's good to learn from
It's the end of the time. This is Dr. Lederman. I'm with Ariel Lederman. We're on WABC. If you have questions during the week, call us at 212-CHOICES, 212-CHOICES. We have a free booklet and DVD about brain radiosurgery, body radiosurgery, prostate radiosurgery. So thank you for listening, and God bless you. And listen in next week. And listen in tomorrow on WOR at 6 a.m. and 9 p.m. Thank you, and have a great day.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.